Hi, I'm Marta Waller. I'm here with Dr. Richard W. Fleming, world-renowned plastic surgeon. Hi, Dr. Fleming. How are you?
Hello.
You know, I think before we get started on anything, I'd like to talk a little bit about your background as a plastic surgeon and, what you do in your practice.
Today, my practice has evolved because I've been there for over 30 years, so things have changed. At the present time, it's pretty much restricted to facial cosmetic surgery. In years past, I did reconstructive work in that area. I did some body work, but I've eliminated all the body work except for liposuction. So my focus now is on facial cosmetic surgery.
Now, one of the things I think is most interesting, we hear a lot about breast reconstruction or breast augmentation. We hear about liposuction, and these are big, big popular procedures, but you say these aren't the most popular procedures.
The most popular cosmetic operation in the country, and in fact in the world, is rhinoplasty. The reason we don't hear about it is that so much rhinoplasty work is done in private offices, private clinics. People my age, I call them mature, not old, mature people that are having their noses done. So it's across the spectrum. It's people of all ages and all groups.
When someone goes, and we talk about the nose job, rhinoplasty, it's not just a big major change. Sometimes the change is extremely subtle. It isn't what used to be just someone with a big hook nose. So when we see these changes, we usually think of it as the big change, but that might be one of the reasons why we don't think of it as a big as a majorly reported surgery.
That's true. The rhinoplasty operation, in most cases, is about finesse. It's not the typical big Roman nose that we joke about. That's unusual. Certainly we see them, but that's not the typical nose. It's about finesse, which can describe a lot of different things. There's a dear friend of mine, Tom Keller, who's a world-renowned chef and has his restaurant in Napa Valley, French Laundry, and he has one in New York called Per Se. And Tom's favorite expression when talking about his food, it's about finesse. Well, we can use the same description when we're talking about cosmetic surgery, because it's not just gross reduction of an overly large nose or distracting nose. It's truly about finesse. And many times, and I'd say most times, it's about millimeters. You're not removing a lot. And I think if we look back in history, 30 years ago, we would see noses that were scooped out, pinched, turned up, because too much was removed. It wasn't about finesse then. So the operation has improved so much that today, state of the art, it is just about refinement and definition, not reduction.
What has really changed in the last 30 years to make this refinement possible?
The improvement is not about instrumentation. Rhinoplasty is different. It's not about technology. The key to any cosmetic surgery, including rhinoplasty, it has to look natural. That's what beauty is, a natural, harmonious result that's proportional to the surrounding facial structures. When you remove a great deal of normal tissue, you don't get a natural result. I think doctors and patients have realized that that's not beauty, that's not aesthetics, that's not our goal. We want to make the nose proportional and in harmony with the rest of the facial features. You don't match the person to the operation, you match the operation to the patient.
So the highest compliment you can receive then as a plastic surgeon is to have no one know you did that person's nose. You want it to be that it's so natural no one knows.
Absolutely correct. If you come across, if you've had your nose done and you come across somebody who looks at you that you don't know and says, "I love your nose," who did it? That's probably not a compliment.
with that, we're going to wrap up this particular session. I'm Marta Waller. This is Dr. Richard W. Fleming, and we thank you for joining us. See you next time.